Well, voluntary assisted dying is now legal in every Australian state. It's there for people who are in unimaginable pain, those suffering from the worst terminal diseases, including motor neuron disease, emphysema and advanced cancers.
But a new background briefing investigation has found that some hospitals and palliative care units are limiting access to the system on ideological grounds. Dr. Prasad Cooray is a senior oncologist based in Melbourne. He's seen this firsthand and says providers with objections to VAD should hand over care to someone else who will carry out the wishes of the patient.
I think there's two things. I think the core business of a healthcare system providing healthcare is the care of the patient. So that's our core business. That's our duty. So when a cancer patient, and that's a group of people I can speak on behalf of, when a cancer patient's dying and it's clear that their prognosis is dire, and they have requested voluntary assisted dying, it's the duty of care of the facility to enable that. And if you have because of a personal belief system, any objections to that, I think the right thing to do is respectfully step away and provide the care by some other members of the team who are able to do that. So that's my position.
So while it may play out like that in some circumstances, we are hearing from this background briefing report that that's not always the case. So have you seen or heard examples like that in your work?
Yes, I've personally experienced examples of that in the area that I work in geographically this part of Melbourne. I think thanks to ABC bringing attention to this and from various other angles, circumstances have changed, and that's a very positive thing, at least in part of Melbourne that I'm working in. But I certainly have personally seen this play out where people having to be either discharged or transferred to another facility to enable them have VAD.
And we should say that facilities do have the legal right to object to being involved in voluntary assisted dying. But when patients are limited from accessing it, or, as you say, transferred out of a facility that doesn't want to deliver, what impact is that having on that patient?
I think it's very distressing, Jo. Firstly, I think we need to understand that there's a huge power disparity imbalance in this scenario. There's someone dying in their most intimate last moments of their lives, and the healthcare system who holds the power over what happens to them in that moment. So I think we need to acknowledge that there's a very imbalanced power dynamic playing out here. And secondly, other people's personal beliefs can certainly have a negative judgmental shame connotations that then is what the patient's experience is as a result. And then thirdly, they're very ill, dying, and transferring them out, and they're in a facility to provide and receive care for that condition, and having been transferred out in an ambulance or any other means of transport is not acceptable in that scenario.
So do we need to see changes in the system to provide that way for people to maintain their ethical beliefs and object if that is their preference, but also allow for access for people who want to pursue voluntary assisted dying?
Absolutely, Jo. I think that's the key. I think we need to hold space for people with ethical objections. That's their right. But in the healthcare system, where care is the core business, that should not get in the way of care. So we need to hold space for both views, and considering the power imbalance here, I think frank and open conversations, having acknowledge that, okay, if your facility has a ethical objection, then what other avenues have you provided so the patient who is the center here, their care doesn't get compromised. And I think there's a lot of work to be done in that space. I agree.